My name is Dr. Larry Hollier. I'm the chairman of the Medical Advisory Board of SmileTrain. I think the biggest innovations in the last 5 years and moving forward are technologic. The use of technology to improve both the training and the outcome for the results in cleft care. If we look back many years ago, computerized technology was used in many industries, particularly the flight training industry. For a long time now, it's been mandatory that pilots practice and train on virtual simulators of planes. That's something that's relatively new in the field of plastic surgery and surgery in general. I think, however, we're moving to an age where it is the expectations that surgeons will train with a computerized virtual reality system prior to operating on patients. So that's something that we're pioneering at SmileTrain in the field of cleft surgery. Currently, we have an open access, web-based program that simulates cleft surgery and all the aspects of it: repair of the cleft lip, repair of the palate, and every aspect of the cleft problem. I think this probably is almost guaranteed to improve the results of the cleft care that we deliver. I would say too that we're pioneering the use of technology, particularly the computer, to track the results of our surgeries. At SmileTrain, we don't just fund the surgery, we ensure that the outcomes are of high quality and that the surgery itself is safe. We do that primarily by having the patient's records uploaded to our tracking system. That tracking system ensures us that the patient's result from the procedure is good and that the surgery itself has been of high quality and very safe. That's something we couldn't really do without computerized technology that we currently employ at SmileTrain. I think the issue with global access to surgical care is finally coming to the forefront in medical care. For many years, when people talked about global medical care, they excluded surgery. In the past 5 years or so, there's been renewed emphasis on pioneering methods to ensure access to surgical care. I think that when we look at the big problems, the limitations in people around the world accessing safe surgical care, first and foremost, it's an issue of affordability, of funding. And that's not just in the developing world, it's in places like the United States. The cost of care, particularly surgical care, is high. And it's high, relatively speaking, in India as well. There needs to be a mechanism of funding that surgery in a way that is sustainable and scalable to populations, particularly the size of India. I think SmileTrain has done a very good job over the last 15 years of refining a system that is capable of paying for that surgical care and ensuring that that surgical care is good and safe. In India now, we are approaching a mark where we will have supervised and paid for almost 500,000 surgeries. And keep in mind, we have probably 250 or so partner surgeons here in India and 150 hospitals with which we work. So I think that question of affordability is probably the most important. Without the money to do this, it can't start. Beyond that, then, you need to start talking about ensuring that the care is high quality and is safe. Every year, we do a survey of our partner surgeons around the world. So keep in mind, SmileTrain is in over 85 countries around the world. We have over 2,000 partner surgeons. So we ask them what the problems are that they see moving forward in providing cleft care to their patients. And in addition to the money, one of the other issues is awareness. Many families aren't aware that with a fairly simple surgery, their child's cleft problem can be gotten rid of. And we need the help of governments and other NGOs to spread the word about this, particularly to more remote areas of countries. We do a great job I think, in India and in all the major cities of increasing the awareness, but it's harder in some of the remote areas and tribal regions in India. So that's one of the problems moving forward. Another big issue is the personnel, the providers, the surgeons, the nurses, the anesthetists. They all need to be very, very well trained in the provision of cleft care so that it's safe and high quality. I get back to this concept of a simulator. We feel that virtual surgical training accelerates skill development in cleft care, particularly for the surgeons. And I think if we continue to move forward with the funding model that we have, and we accelerate the training model we have with virtual simulators, I think putting those two together really gives us a very bright future in cleft care. Very strict guidelines in place for operating on patients, at least when that surgery is supervised by SmileTrain. The Global Medical Advisory Board, in conjunction with the Indian Medical Advisory Board, has a very comprehensive list of parameters for the selection of patients for surgeries and what's necessary in the hospitals for those surgeries to occur. So our safety and quality guidelines are something that every partner hospital and partner surgeon has to sign on to before we accept them in terms of care for our SmileTrain patients. Those parameters are something that we check on quite frequently with our partners on the ground. And if there's any perceived problems through our online submission form, we work with the hospital to correct those over time. So safety and quality guidelines are the first and foremost thing in our mind before we allow an institution to partner with us in taking care of cleft patients. The biggest hope in the near future is to move to a situation where we build self-sustainability for cleft care in the countries in which we work. I think we've done a great job in funding surgeries in the 85 countries around the world where SmileTrain has a presence. But we'd like to see the local governments provide for that care themselves from a financial standpoint. Now, some of that is fundraising. I think that, for instance, in India, we're doing a better job of raising money from the public and from corporate partnerships. But the government also needs to play a role in this. I think there are many opportunities. I mean, in terms of contributing to cleft care, we tend to think of it as just surgery, but it's not. To successfully care for a child with cleft, it takes a surgeon, it takes an anesthetist, and it takes a nurse. And there are always great careers, very rewarding careers in all of those specialties. But never forget that cleft care occurs over really the first 18 years or so of that child's life. And so the child needs help learning how to speak appropriately. They need help with how to eat and maintain their nutrition. So speech therapists, dietitians, in addition to nurses, doctors, anesthetists, all of these are careers that are really required to bring the child to a state of a productive health in their adult life. And when I look at it, remember, all the people who are doing it now, they're getting old. And sooner or later, we need to replenish that supply of providers. And what a rewarding way to spend your life, helping children live happy, productive lives by taking care of what amounts to a very simple problem that we know we can cure. It would be wonderful if all the problems in this life were as curable as cleft was. And I think it's important to remember that SmileTrain is an organization that is always focused on one problem alone, the cleft child. And I think by doing that and maintaining our focus, we've done a wonderful job in reducing the cleft burden around the world. And again, restoring these children to very happy, productive lives in their communities.